Navigating Healthcare 2024. This Navigating Healthcare 2024 recording took place at the College of Health and Human Services at Western Michigan University on Friday, January 19, 2024. Our first speaker is Miranda Pearson from the Kalamazoo Area Agency on the Aging. Our second speaker is Lowell Rinker, retired Western Michigan University Vice President for Business and Finance and Chief Financial Officer. Our third speaker is Paul Miner, a staff agent at Endres Insurance Agency. Paul specializes in supplemental health insurance plans.
I will follow Miranda with a real-life example with my wife's situation and show you what the costs with and without being in the WMU plan. And basically following me will be Paul Miner. He's an agent with the Endres Insurance Agency, and he's going to talk about the process of applying for Medigap or Medicare Advantage policies, and help you also choose if you want additional coverage for dental, RX, and vision. He can also walk you through how that works as well. So we will make time at the end of all three presentations for Q&A. So if you could just jot down your thoughts and questions and then hold them till the end, then we'll try and address those then. So with that, Miranda.
All right. Hello. Good afternoon, everyone. My name's Miranda, like Lowell said. Do you want me to stand and walk around? Is sitting okay? Anybody have a preference? What'd you say?
You want.
Perfect.
Okay.
Thank you. Okay. So yeah, my name's Miranda. I'm with the Kalamazoo County government, specifically the health department, and then within there, the Area Agency on Aging, and then another acronym is MAP. MAP stands for the Michigan Medicare Medicaid Assistance Program. Trying to go to the next slide. There we go. Okay. So we're briefly going to go over kind of what MAP is, how we help people in the community, some Medicare basics. I want to preface this. My talk is going to be targeted, kind of like Lowell said, mainly on just traditional Medicare stuff. So people like you guys who have fancy retiree health coverage options, it can kind of get more in the weeds with that type of stuff. So those are questions for like Lowell or Paul, helping things switch over. And then I'm just going to briefly touch on advantage plans and supplement plans. Those terms kind of get tossed around a lot. And I feel like a lot of people use those terms interchangeably, and they are two different types of plans. And each actually advantage plan has two names for itself, and so does supplement plan. So there's a bunch of acronyms and stuff that happen, but hopefully today I can kind of help with any sort of confusion or overwhelmingness with the Medicare world. So like I said, MAP stands for the Michigan Medicare Medicaid Assistance Program. This program is nationwide, so if you move to Florida, Alaska, Wyoming, there will be a MAP program in that state. It's not going to be called MAP. It'll be called the SHIP program, so the State Health Insurance Program. So if you have friends or family that are struggling with Medicare questions, you can direct them to their local SHIP. This program is mainly volunteer-based. So here in Kalamazoo, I have 23 volunteers that help run the program. All of these volunteers, they go through very detailed training. So it's not just, people sign up and they're just willy-nilly helping people with Medicare. These counselors are certified and fully trained. So they know what they're talking about. What we do, our goal is to provide free and unbiased Medicare counseling. So we are not with any insurance company. We're not trying to, get you into a specific type of plan. What our goal is to empower people to make sure that they feel good about making insurance decisions. So then when they select an insurance plan, they can sleep at night knowing, okay, yep, I understand what I selected and what coverage I'm going to have, because there's so many different options that you're kind of given when it comes to Medicare. All right. I also want to preface that I edited the wrong PowerPoint. So my numbers are from 2023, I think. So when we get to those, I will ignore the numbers on the slide and I'll let you know the new numbers. But when it comes to insurance, there are some definitions that are really important to kind of know when you're looking at insurance stuff and trying to figure out your plans. Um, the first one is going to be, I usually do deductible first. That's, your basic, you need to pay this amount before your insurance is going to start kicking in. So that could be $300, that could be $900. It's a number that you have to pay before insurance is going to start kicking in. The next two, co-insurance and co-payment, those are going to be your required share of a cost of a service. Co-payment usually looks like a flat dollar amount. It's going to be $20, $40, that sort of thing. A co-insurance is going to be more of a percentage. So what you usually see is like the co-insurance for Medicare. Medicare covers 80% of things. We're responsible for 20%. Durable medical equipment, that's usually like a percentage, so 20% for durable medical equipment things. The next one is going to be a maximum out-of-pocket cost. This is going to be the limit that you can reach on out-of-pocket spending, usually in an Advantage plan. That once you've met that, your plan is going to cover all Medicare covered services at 100%. Usually that can be, I think the lowest I saw this year was maybe like 3,800, anywhere up to like $8,000 annually. So you might think, oh, that's a nice safety net. If I, know that I go over that, things could get covered. But some people, that's a lot of money to them. So, sometimes that could be out of the question. The next one is formulary. Anybody who takes any sort of medications, whatever plan you go into, whether it's a standalone Part D plan or an Advantage plan, you want to make sure the medications that you're taking are on that formulary. Otherwise, you're going to be responsible for paying for the cost of that. If your drugs are not on a formulary, there are some fancier drugs out there that might be new. There are some like prescription assistance programs that can help, things like GoodRx, Needy Meds. They can help cover stuff, but you really want to make sure that your drugs are on the formulary. And the last one, again, more so for Advantage plans, you're going to see different types of little acronyms next to your Advantage plan. So things like HMO, PPO, and POS. HMO is the type of plan that really wants you to stay in network. They don't want you venturing out into a different network or seeing providers that are outside of their network. If you do venture out, in an HMO plan, you are usually responsible for paying 100% of whatever you go and do outside of their network. If you have POS attached to your HMO, that kind of allows you a little bit more flexibility. You usually have to get like a prior authorization beforehand, but you can still kind of go out of network a little bit. The PPO, that one gives you a lot more flexibility. You can go in and out of network. Sometimes Advantage plans, they'll put the same cost for in network and out of network. But some plans will say, if you stay in network, we'll cover this much. But if you go out of network, we're only going to cover that much. So that's really important to look at if you do decide to look at any sort of Advantage plan, is to make sure that either you're an HMO or PPO, and whatever one you choose, that your doctors and specialists are in network. So there are 4 different parts of Medicare. Part A is your hospital coverage. Part B is medical insurance. Part C are your Advantage plans. So there's the 2 names right there. And then Part D is your prescription drugs. Ultimately, you have 2 kind of options when you get to retirement. Is the left-hand side of the screen, which is traditional original Medicare, or the right-hand side, which is an Advantage plan. Today, we're kind of focusing more on the supplement side of things. So I'll go over what Advantage plans, what some pros and cons are, and whatnot. But on the left-hand side of the screen, you have A and B. Those are your traditional. You want to get those 2. Those are important. If you don't get those 2, you're going to see some penalties. You can also choose to add on a Part D coverage and the supplemental coverage. When I say kind of choose a Part D, You do want to have a Part D plan because you will get penalties if you don't sign up for Part D. But there are some people who, like veterans, maybe they go to the VA center and they get their meds through there. So you don't necessarily have to have a Part D plan if you have credible drug coverage somewhere else, but you really want to make sure that you have some sort of credible drug coverage. On the left-hand side of the screen, you don't have to worry about networks really. You can go wherever that accepts Medicare. You won't have any dental, vision, or hearing coverage on the left-hand side of the screen. The government has yet to see vision, dental, and hearing as Medicare benefits. And then you don't really need referrals on the left-hand side. Like I said, if they accept Medicare, they're going to accept that side of the screen. The other side is going to be your Medicare Advantage plans, also known as Part C. And what that does is going to be insurance companies like United, Blue Cross, Priority. They kind of take over your Medicare stuff and they lump everything all into one. So you'll have your A, B, and D all into one fancy Part C or Advantage plan. These are what you probably see if you have cable TV on the commercials is, Joe Namath talking about sign up for this plan because, we'll get you some extra coverage or money back in your paycheck. That's what you're seeing there. And so there are some extra perks for Advantage plans, dental, hearing, and vision. These do have those maximum out of pocket costs, but you have to make sure you're in network for things on this side of the screen. So it can be kind of tricky there. You can't have both. You got to pick one or the other. I have seen a few people have a supplement and an Advantage plan, and they thought that they were, duly covered. And I was like, you are just paying too much money for not double the coverage. So you have to go with one. All right. Yep. And my numbers are all messed up. So Part A, I usually most people get Part A for free. People who don't get Part A for free are people who maybe haven't worked 40 quarters or 10 years into the system. This could be stay-at-home moms. This could be people who've immigrated here who haven't contributed into the system. So there might be a little extra that they would have to pay to get A, but usually most people, $0 a month for Part A. It's usually free. There is a deductible for Part A though, and this deductible is a fancy deductible. It's $1,632, I believe, in 2024. This one is a benefit period deductible. And what that means is that if you go into the hospital in April, you fall, you break your hip, you have to meet that deductible first. Like we said, you got to meet it and then your insurance will cover. You leave the hospital, and then let's say you don't go back into the hospital until October. You're now outside of that 60-day benefit period window, and you have to meet that deductible all over again. So Part A can kind of get expensive if you're, going in and out of the hospital outside of those windows. What Part A covers besides your hospital coverage is going to be hospice, and it's also going to cover skilled nursing care facility. Don't think long-term care, think rehab. Long-term care is going to usually be covered by Medicaid. Now, Part B is the other one that you want to make sure you get. And this one, there is a monthly premium for it. This year, it's $174.70. This one, usually everybody who's drawing on Social Security, it gets taken out of your Social Security check. So you're not having to write a check or make a payment each month for this. It just automatically gets deducted. This one also has a deductible. I think it's $240 this year.
Yep.
Thank you. Yep. This one's going to cover your outpatient stuff. So doctor's visits, labs, durable medical equipment, ambulances, preventative services. This one also, if you make more, you might have to pay additional in your Part B premium. I believe the number for this year is if you make more as a single individual, more than $103,000 a year, you'd have to pay a little bit more in addition to that. So just keep that in mind. They usually look at your last two tax returns. So usually sometimes people can get hit with once they're retiring. That's where some of those taxes can increase your premium, and then it can drop off after that. But if you make more than that, you will see that number increase. I'm gonna skip over C and go to drugs. Part D is the other part that you want to make sure that you have drug coverage. These ones, again, I think there's like 32 standalone drug plans in the state of Michigan this year. All of them vary by their premium costs. I think the cheapest this year that I saw was $5.32. So can get that low, or it can get, up into the 60s or $70 a month for standalone Part D plans. These also have deductibles. This one, this year, the max that they can charge as a deductible is $545 a year, and copays vary. So this is something that we can help with. If you come to our program, we can sit down, take a look at all your medications, and see which standalone Part D plan would be beneficial for you. Think, go back to C. So then part C, kind of like I talked about earlier, you're gonna have all of the other stuff that we talked about. You'll have A, B, and D all lumped together into one standalone plan, but you'll have some of that extra dental, vision, and hearing coverage, and maybe some over-the-counter benefits. Flex cards have been a really big thing. So I've seen anywhere from like $50 a quarter to $100 a quarter that people can spend on over-the-counter necessities, whether that's briefs, supplements, vitamins, really anything over the counter. Transportation benefits and emergency response buttons. With the Part C's, what gets people on TV is that they're $0 a month. That's the big thing. A lot of Advantage plans are $0 a month. But there are hidden costs within Advantage plans once you kind of dig into the summary of benefits. Even though you might be paying $0 a month, you're still paying your Part B premium. And then you're going to be paying co-pays and co-insurances within those Advantage plans. And then the other option is supplement plans or Medigap plans. So those two terms are interchangeable. With a supplement plan, it does exactly what the name is. It's supplementing your A and B. So those things that I talked about, like the Part A deductible, or the 20% co-insurances for Part B, depending on what supplement plan you select, it's going to take care of those additional costs. This picture right here, I don't know if everyone can see it well. Medicare likes to use letters and not kind of change it up. So you'll see that it's got, A, B, C, D, F, J, K, L, M, and N. Those are different types of supplement plans. And what's nice about supplement plans is that if you pick a plan in Plan G, for example, and you have two options. You have a Priority Plan G and a Blue Cross Plan G. They all have to cover the same thing. They're all standardized. The thing that's different is the monthly premium. So Blue Cross could say, we've been around the block a few times. We've been here for a very long time. We're going to charge, maybe $150 a month for that Plan G. And Priority might say, we're going to charge $120. So you're going to get the same coverage in that G category, no matter who you go with. It's just going to be a different cost associated with it. Plan G is the most popular one. Other ones that you can get, they might be cheaper in your monthly premium, but they're going to provide a little bit less coverage. The next one that people usually take is D if G is not an available option. This is not going to be your traditional Advantage plan with a $0 a month premium. Premiums can vary with different plans. Like I said, if you choose an A, it might be, $80 a month. A plan G could be, $150 plus, depending on your age, where you live, if you smoke, and your gender. So these can get expensive. Supplement plans. So you're paying your premium for a supplement plan. You're paying your Part B premium still, and then you have to pay a Part D premium. So there's three things that can lump in and it can add up quickly. I've seen couples or single people, their monthly premium to pay for all their health insurance is upwards of $300, so you really have to sit down and weigh those pros and cons to see, okay, how often am I going to the doctor's office and using my health insurance? And is it that cost benefit analysis gonna be best? Ways to enroll. Usually I think everybody in the room here already has Medicare Parts A and B. So that would be Social Security if you don't have that already. Part C and D are gonna have a couple different options. You can be a strong independent person and go to Medicare.gov, the plan's website, or go to a licensed insurance agent and get some help there. And then the supplement plans, you have to go through a licensed insurance agent. I think, yeah, that is all that I have. And we're doing questions at the end, right?
Yep.
Perfect. Just take this. That's it.
We're taking questions at the end. Oh, yeah. Bring up the next one. We'll be right with you, folks. Just getting the next PowerPoint up. Yep. Okay, I'm going to pick up where Miranda left off on the different plans. Mine is my part of the presentation is to show you a real life example of Western's plan for a spouse and for the employee itself, as well as what you could do outside of that. So there's really, as Miranda mentioned, there are really two options you have. One is the Medicare Advantage plan, which basically, this might be kind of a rough way to call it, but you're basically selling your Medicare to an insurance company. I'm not a fan of those. There's typically more hoops to jump through. I've read situations where you can run into claims that get denied or other authorizations that get denied because basically, they're in it to make a profit. And once they own your Medicare plan, the way they make the most money is if you don't use it much. So Medigap G, as you heard her say, is a more popular one. That one actually operates the most like Western's PPO that you're used to, and that it wraps around. For those of you that have not made that jump yet from active employee to retiree, basically you're required to be in Medicare in order to qualify for the Medigap or for the WMU PPO for retirees. And basically what the PPO does, Western's plan, is it wraps around Medicare. Medicare is primary. What Medicare doesn't cover falls to the Western plan. You heard her mention the 20% copay, coinsurance. That's one thing, for example, that it picks up, but there are some other things as well. So my wife is in the plan G, and with United Healthcare, that's the company she's with. They, at the time she signed up, she's been in it 5 years now. At the time she signed up, they front end loaded a 39% discount that disappeared. That discount disappears 3% per year. So she's in year 5. So she's now paying 15% more than she did when she started. But as you'll see and I should point out, if you're a new retiree, you would be getting premium numbers probably lower than what she's getting because you would start at the beginning of that discounting. Not all Medigap plans do the discounting route. United Healthcare is one that does. And it's a way of attracting people into their plan. It kind of balances out over time is my theory, but in any case, like I said, it covers the Medigap plan covers basically Medicare qualified expenses that are not covered by Medicare. And I'm talking about the copays and the coinsurance and all that kind of thing. So it's very much like you will see it's going to be very similar to what you're experiencing with Western as a retiree. Basically, you'd have you put your claims through Medicare, and then they would bounce over to the Blues. Same thing with this. You put your claims through Medicare, and then they would bounce over to the Medigap plan. So I want to take you to the spouse. Well, before I do that, I want to just issue a little bit of a disclaimer. Leaving the retiree system, healthcare system at Western can be a scary proposition. I mean, I lived and breathed this stuff when I was VP, and it was scary for us. And I knew all the numbers. So, I can understand why people would be nervous about jumping off of something they've been familiar with. But I will also tell you that there's a couple caveats here that I think are helpful to know. One is that as long as the retiree stays in the Western plan, the spouse can always go back to the Western plan during open enrollment period each year. So if you don't like it, you basically were in it for a year, you don't like it, you want to go back, you can do that. I couldn't understand why anybody would want to do that, but you could. So it sounds like it could be scary, but it shouldn't be. And the thing that makes it less scary, and I'm going to show that to you in a minute, is saving $9,000 a year. That's what Kathy is saving with her use of this. And I'm going to run through these numbers here in just a second. See if there's anything else I've missed. Okay, so the numbers on the slide that you're looking at right now, this is the spouse slide. They're based on current year rates for the WMU PPO, for United Healthcare, for Medicare premiums. And the message we got for 2024 is essentially the same as it was for last year. All of the rates have gone up a little bit, nothing catastrophic. And if you look at the spouse slide, it's up there now. We're going across the top. You see the line says annual premium. The WMU plan, $10,168. That's the actual amount it costs extra to put a spouse on for the year. The 2,096 is the accumulation of the Medicare premium. So the total premiums for the year with Western's PPO and Medicare are $12,264. If you look on that same line, annual premium, the AARP United Healthcare Medigap G plan is $2,712. Now, I will also tell you that includes some riders. There's a $47 a month dental she's got included in that, and $5 a month RX she's got included in that. And if she would have decided to add vision, that would have cost, I think, another $15 on top of that. But she didn't because her vision claims are all under medical, and that's a decision each of you need to make. But so $2,712 is the annual premium for the Medigap plan. Then you have that same $2,096. So the total premium is $4,808. So, you've got, over $7,000, about $7,500 difference just in the premium each year. And the news gets better because the annual deductible, you'll see under the WMU plan is $900. Under Medicare, it's $1,872. And that's a combination of the $240 that Miranda mentioned and the $1,672, I think, or $1,632. Yeah, hospitalization Part A has a 1632 copay. Actually, it's per event, so it could be, more than that if you didn't have a supplemental to cover that. So what I'm saying though is the annual deductible from the WMU plan is 900. So that really takes care of the Medicare. So the total exposure is just the 900 because you've got WMU plan to pick that up. And the out-of-pocket max of Western's plan is 2,000. But the good news is that the 900 of your annual deductible applies to your out-of-pocket max. So your exposure there is only 1,100 only. So, but if you add that column up, the 12,264, the 900, and the 1,100, you've got $14,264 that if you're an active user of the plan, you're going to spend about that much money every year. On the other side, on the right side of the chart, that same number adds up to only 5,048 because you don't have out-of-pocket maxes and your annual deductibles with a UHC plan are limited to that $240 because the Medigap plan covers the hospitalization co-insurance, and it covers everything over 240 for your regular labs and office visits and things like that. So those two numbers together, you're looking at, it's 9,200 and change. And who wouldn't want to save that kind of money? And actually, if you're a 65-year-old retiree, it's going to be more than this because the rates, Kathy being 5 years into this program, but she's 71 right now. So she's 6 years into Medicare. And so the rates are better for a Medigap plan in the younger years. So, but I'm just putting this out here as a presentation of what we actually are saving each and every year.
Isn't the 10,168, isn't that both for you and your wife?
No, it is not. That is just the spouse piece. Yeah, it's big. Yep. What I did is I took the rate for the retiree and the rate for the retiree plus a dependent. Then I subtracted the retiree out. That's what you get. Yeah. So it pays big time to consider doing this. And I'm just going to flip over here to the retiree themselves. My bottom line is I absolutely recommend that you consider taking your spouse off of the WMU plan and looking at a Medigap plan. That would be my advice on it, would be a Medigap. I'm not a fan of the Medicare Advantage. I think for lower income people, it has some attractiveness, but this is much more like what you're used to with Western's plan. So it's a good plan. My wife's sister is a bit older than she is, and she and her husband have been on this same plan for 10 years, and they've had some significant health issues that were handled very, very well. So it has not been a problem. With the retiree, the story's a bit different, and it really boils down to the premium. That 1932 is what a retiree pays just for their own health plan with WMU. So if you take all these numbers on the chart are the same, except for that 1932. So what it all boils down to is the 6,028 versus the 5,048. There's only about $980 worth of savings to make that switch. And I will tell you, there are a few things, not a lot of things, but there's a few things that Western's plan covers, like therapeutic massage or an annual physical, that aren't covered under Medicare. You do get an annual wellness exam through Medicare, but that's not a hands-on physical. If you want a hands-on physical, you have to pay up for the difference for that. So I do want you to know that all of my notes for my portion of this, as well as these charts that you see, and with all the little caveats that go with them, are already up on the WARF website. So you can just go to wharfwmu.org and click on the link that says retiree healthcare information.
Have a good weekend.
And it'll show you all that. It also has in it contact information for Miranda, Paul, and myself. So you've got phone numbers and email addresses and that kind of thing if you've got questions we don't end up addressing here today. So I think that's pretty much all I had wanted to cover with my portion of this. So with that, I'm going to ask Paul to come up.
Well, one question: when does this have to happen? Can it happen anytime?
It really can happen anytime. One of the reasons why we are now doing this in January, we tried to do it late fall, but we didn't always get good timing with Western's new rates and all that kind of stuff. So we just decided to push it into January. There is a lead time. I mean, you know, for example, you know, to get all this done, you got to do a little bit of research, and Paul's can talk about how he can help with that. But you know, it will take several months probably to get rolling on this. But you know, there's no, because you can, with Western's plan, you're paying by the month. So you can stop paying by the month anytime. So it makes it less time critical.
It's not tied to that October 15 and November.
Yeah. Yeah. I'm going to hold questions until we get done with Paul. So. All right.
Your own keys, or can I?
Yeah. Can just use the added keys,
Perfect.
I guess. I'm just checking if it's.
All right. Thank you so much. I'm Paul Miner with Endra's Insurance Agency, and I'm so happy to be here today. Already heard a lot of good things. How does Medicare work? And then Lowell puts that together that really shows the difference there between what Western Michigan has to offer, especially for the spouse, and what else is out there. I deal with a lot of people that are on retirement insurance. I remember one day I had back-to-back people on retirement insurance, and they were paying like virtually nothing. And I'll look at them, I'm like, look, I can sell you something, but look at these numbers. What you have is fantastic. Unfortunately, that is not the case with the spousal insurance. Oh, my stars, I don't want to be mean, but this feels like highway robbery compared to everything else that I deal with. When I see that $14,000, or even if you don't go to the doctor and you're paying over $12,000, oh man. But anyway, okay, that was a great intro. Let's move on. So there we go. So just real quick, and this was already covered, Part A, basically hospitalizations, Part B, doctor outpatient, whatever. Both of those need to be in place, let me go back, before you can get any other insurance. And so if you're already on retiree insurance, you have A and B, you're right there. If you're 65 and about to go on that, then that's what you need to get anything else. So two basic types we already saw: original Medicare with a Medicare supplement, prescription drug plan, maybe something like a dental plan, vision plan, hearing plan, some form of that, or an Advantage plan. It's one or the other. Those don't mix together. So a supplement, here's where we're going to spend a little bit of time here. Great network. And when I say great, I can't say great any better than great, because any provider in the United States of America that accepts Medicare will accept your supplement. So do you have a network? Well, yes, because there's probably a few providers out there that don't take Medicare, but are there many? No, and you probably wouldn't want to go to them anyway. So that makes it so simple. So you, oh, hey, I've got this going on. I'm going to jump down to the Cleveland Clinic. No problem. You want to go over to the Mayo Clinic? No problem. You're vacationing in Arizona or you spend 4 or 5 months there? No problem. Or Florida or whatever it is. That is nice. When you just about eliminate the network, it makes it so easy to use. The other thing about a supplement is that you pay up front. So you pay your premiums, and then when you use it, you're going to spend as much as $240 in a year on a Plan G, which is by far the most popular one. So that's a very known cost. And even with yours, like a $2,000 max out of pocket is very low considering that, but the premiums are so high. That's what makes it just, in my mind, almost unaffordable. And then you do need, so when it comes to the medical portion, a supplement, bar none, easiest to work with. Makes it so nice. But it only covers medical. So at the very least, you would need to do a prescription drug plan with that. And there you have a monthly premium. And I say I left the old deductible in there. It's $545 this year. How did I miss that one? But we have plans between $0 and $120 a month for prescription drug plans. That's a huge range. And the thing is, what every one of those plans, and we've got 20 of them in Kalamazoo County, has a different formulary. So one of the things we do as an insurance agent is we check all of that stuff ahead of time. And that's exactly what Lowell was talking about when he said, hey, it might take some lead time on this because you want to check some stuff. And so that's where I come in. I'll check all your prescriptions. As a matter of fact, I check them with every plan in the area. And then we'll see what you have, how that lines up with the formularies that are available. And whichever one seems to have the best overall value between what the copays are and what the premium is, then that's what we look for, because you can change your prescription drug plan every single year. So if there does need to be change, we can do it then. That makes it easy. I also check and make sure that whatever drug plan you're looking at is going to be associated with the pharmacy that you want to use. I mean, all these things. Supplement is super convenient because there's like basically no network, but everything else has a network. That's just the way life is. So there we have prescription drug plans. Let me check all of that stuff ahead of time. I'll jump into, or before I jump into that, let me talk about the dental networks. And this is true for everyone. We've seen a lot of dentists jump out of dental networks, by the way, just because when COVID hit, like no one could go to the dentist. And so they had all this backlog, and then people go to the dentist and they're like, we're 6 months in advance scheduling. I don't know if anyone had that problem, and or longer. And so a lot of dentists are like, hey, I don't even want to mess with insurance. We'll just drop out of the network and we'll charge full price. And I get that on their end. And I think it's going to be a few years before that settles down. They don't have quite the backlog. They bring more people in. And that's not to say that dentists don't stay in networks. There are still a lot, but everyone, even Blue Cross Blue Shield, the plan you're on now, you have a dental network. That's the way it works. It's just been interesting to see. And that's another thing that we would want to check also. Because if you wind up with want a dental plan to go with, then we want to pick a plan that is going to have your dentist in network. And that's another thing that I check. As a matter of fact, and I'll say it again at the end, but one of the great things is there's a lot of things that I can do even ahead of time. So let's say, for instance, you're talking to me like, Paul, I want to find out more, something like that. Like, hey, email me some of that information. I can check all this stuff ahead of time so that when we meet, we're prepared and we can discuss this stuff. I really like doing that ahead of time, and we will eliminate as many surprises as possible. A little summary of Advantage plans. Lowell was dissing on them, but I understand, and especially when well, it's not that money's not an object, but compared to $14,000, anything you spend on an advantage, anything you spend on a supplement will still feel like a bargain, So, but they are also an option, and it's nice that we have more than one option, because I do want to say this as I'm approaching these Advantage plans, that with supplements, well, never mind. I've got it coming up on my slide. Let me just give the summary. Strong network, And so you might have as many as like 94% of primary care physicians and 70 some percent of specialists and these kind of things. You have a $0 premium, so you don't pay for the plan unless you use it. You co-pays when you use. You still have availability for most of the plans in all 50 states. They include a prescription drug plan, and then they do some of these perks like dental, vision, hearing, over the counter. A lot of those are preventive portions of those, but that's why I dubbed them the all-in-one plan, because they include a little of everything. All right, now a little bit more into supplements. Realistically speaking, you'd be looking at one of three: Plan F, Plan G, and Plan N. Plan F is if you were turned 65, 2020 or later, it's not available to you. So because with Plan F, there's no deductible. You just go in, you pay zero from the start. And Medicare basically said, hey, we want you to have some skin in the game, so we don't want to offer Plan F anymore. And so if you turn 65 as of 2020, it's not available to you. One of the things with that, though, is that means the overall population in Plan F is older. And so therefore, what we've seen is the rates are rising faster. And so the difference between a Plan G and a Plan F is well more than that $240 deductible. And so that's what makes Plan G so attractive. And then there is a Plan N. And Plan N, you would have some co-pays with it. And Plan N is generally cheaper. I quoted a couple of them this morning. And depending on what company it is, it could be about $30 a month less. The only thing, and it's still fine. I've got people on Plan N, I've got people on Plan G, I've got people on Plan F. But the only thing with Plan N is that they do not cover excess charges. And excess charges are where someone can subscribe to Medicare, a provider, but they don't subscribe to their rates. Now, we really don't see that in Michigan, but you could if you were elsewhere. And that can be as much as 15% of any Part B bill. So it's just a little caveat there. And I bring that up not to overwhelm with information, but I bring that up to show you that, like, this insurance life is so much more complicated than it should be. And it never gets easier. There's all these little things and this little caveat here and there. And it's like, it ought not to be like that. And I would love if we made everything super simple. And if I worked myself out of a job, I'd be so happy because life would be so much easier for everyone else. And I'd go do something else. But unfortunately, it only gets worse every year. It's like we add another layer on instead of just kind of merging everything together and fixing it, at any rate. All right, so again, with the supplement, because I jumped the gun a little bit earlier, unparalleled network. Provider accepts Medicare, they accept your Medicare supplement. I can't tell you how easy that is. I had a gentleman in my office a couple months ago. He was thinking about switching from a Plan F to an Advantage plan. And the reason is because he was paying over $5,000 in premiums. And for him, that was a lot. And so he's weighing all right, I'm going to save money if I switch, but now I have to pay co-pays. And I've never had to do that. I've just walked into the doctor and it's done, ease of use. I get that. So another thing about the supplements is that they cover what Medicare doesn't. And what that means is that Medicare is the driver. If Medicare approves it, your supplement is right there with it. I have never experienced, well, let me say it this way. I've experienced one problem with someone with a Medicare supplement. And it was when Borges was switching over to the Woodbridge office. And for some reason, they couldn't retain his information. And so he was getting a bill for the full amount, and they kept saying he didn't have insurance on file, which was not a Medicare supplement problem. And that's the only problem that I've experienced. So ease of use is right there. That's what I'm saying. That $240 a year, you're all set. The only thing it won't cover is that $240, right? And then any procedure that is not Medicare approved. So anything that would be like maybe cosmetic, something like that. So you pay your premiums, you pay the $240. And after that, your doctors, your outpatient procedures, your hospitalizations, all those things, you just pay zero. Makes it so easy. Signing up. All right, a couple of things here, because again, they cannot make it easy. If you leave your group insurance, you have, by the way, a special election period. And we're going to talk about that when we go to prescription drug plans and advantage plans. But the sweetest spot for signing up for a supplement is called open enrollment. And again, fascinating, open enrollment means something different for supplements than it does for prescription drug plans than it does for advantage plans. I mean, how convenient is that? But when it comes to supplements, when you turn 65 and you get Part B for the first time, that is called open enrollment. And open enrollment means that a supplement has to take you, no questions asked. There's no medical, it doesn't matter. You could have everything in the world wrong with you. They won't even ask. You're in there. That is a great spot to be in. There's also a guaranteed issue. And there's a few scenarios that trigger a guaranteed issue, but the one we're going to be looking at here is when you're leaving a small company group insurance for the first time. And if you're older than 65 and a half and already have Part B. So that really doesn't fit into our scenario for your work at Western is not that small. If you don't have open enrollment or guaranteed issue, then you will have to go through medical underwriting. And we've done that a lot. I think I've met with as many as 15 or so Western Michigan employees this last year. And many of them, not everyone, but many of them chose a supplement. And a lot of those we would have to go through medical underwriting. And so there are certain things that might, where they wouldn't necessarily take you, but you don't know until you meet and find out and go over some of these questions. So you'll answer a series of questions about your health status, and there's different companies that have a little bit different underwriting procedure. So even if you can't pass one company, you may be able to pass with a different company. I just had to redo my life insurance this week, and I had to answer all of these questions. Oh, my stars, question after question. And I actually passed. It was unbelievable. So, either they can accept the application, with higher rates, or they can say no. Because with a supplement, you can apply anytime you want to, but they don't have to take you. With a prescription drug plan and advantage plan, you can only apply during certain times, but they have to take you. So it's kind of interesting how that works. And I do like the idea that at least we have choices, you know. So as far as signing up goes, you need some basic information like name, address, phone number, email, Medicare number, possibly Social Security number, possibly some previous healthcare information, financial information if you want to have it withdrawn out of your bank account, or you can have some things just taken out of Social Security, like your prescription drug plan you can, but not your supplement. So those kind of things that you could have, which is pretty basic stuff right there. And then if you want to look at other insurance, the prescription drug plan, the dental, the vision, the hearing, all those things, I can find out beforehand and give quotes for. I'll give you an idea. If you're turning 65, do we have any people here turning 65? That would be a bad number to go with then. We'll just use Lowell's numbers then that he had. And those are going to be pretty close. Different carriers will offer different things. United Healthcare, by the way, is finally offering a dental go with. This is the first year that they've done that. They actually started late fall, and but theirs is actually kind of pricey. But it might be interesting to see if the dentist is a network, if that's an interesting switch. So every dental plan has a different network. So depending on what one you go with, whether you go United Healthcare, Blue Cross Blue Shield, or Cigna, or Mutual of Omaha, or something like that, then we can check dentists, and those can be some kind of lateral switches that would help keep your dentist in network. And companies, as far as companies go, I'll say this. Some companies have incredibly low intro rates, and they raise their rates very quickly. Some companies have a certain rate and they keep there for a while and then they jack it up like that, because there are like 50 companies that sell supplements in our area. And I don't keep up with all of them, but I am certified with 13 companies because I want to give people choices. So we've tried to identify the ones that either offer a certain value, like a great dental go with or something like that, or companies that have maintained their rates and maintained them well over the years. So prescription drug plan, I already talked about a little bit. Every formulary is different. You can change it every single year, just based it off the prescriptions that you have. And I've got a lot of people on $0 plans. I've got several people on $120 plans. It just depends on what drugs that you're on. Here's some other things. It's the simplest as far as dental insurance to go with the add-on that goes with your supplement, but that doesn't always work. And there are companies that will offer a dental add-on no matter who you're with, you can still get this add-on. So no matter what, we can figure something out is the idea. Vision is often grouped with dental insurance. And but basically, when we're talking about vision insurance, we're not talking about the medical portion. So if you need to get cataract surgery, that's medical. So that would come under a supplement or advantage plan. But a vision insurance, what we're talking about is either a discounted or free eye exam and a discount or money towards eyeglasses or contact lenses. So that's not a huge component. It's very easy to go out with, but or to go without, but that is there if you want it. And the same thing with hearing insurance. A lot of times you might get a $0 hearing exam, but I think there's a lot of places around town that gives $0 hearing exams. And you might get smaller copays or even discounts on hearing aids. So that's not a major thing, but it might be a nice add-on for you. So time frame. When you can leave group insurance, when you leave your group insurance, then that triggers a special election period. Now, the normal time we all think of is that October 15th through December 7th. That's annual enrollment. And so you make a change then, and it starts in January. And that's by far the most common. But there are these other, I have a book like 20 pages of special election periods. It's ridiculous, again, with all of these different rules. But one of those is leaving group insurance. So whenever you leave your group insurance, special election period, you can sign up for a supplement, you can sign up for a prescription drug plan, you can sign up for an advantage plan. Insurance goes by the month. So like even if you wanted it right now, hey, I want to start this. Well, the soonest they can start is February. I do recommend that you do things as much ahead of time as possible. And I think it's great because you just get information. I met with a couple on Wednesday that weren't retiring until mid-September, but they wanted to find out so they could prepare. And so we went over all that stuff. I think that's fantastic. I met with a couple today. They're not retiring until June. They won't need it. And we went over all the stuff again. And that way there's no surprises. There's a couple little things we needed. And so we're going to email back and forth and get it narrowed down. So that way I'm able to do a more thorough check for them after we met. I think that's great. If you're thinking of looking at this and making the move, get with me anytime. If you're like, yeah, but I don't think I'm going to do it till 6 months from now. Well, hey, let's meet now so you have an idea of how to plan and what'll work for you. I think that's wonderful. Switching supplements, I had said before, you can do this at any time. But again, insurance goes by the month. So the soonest you could have something start would be the following month. Prescription drug plans, annual enrollment is the time to do that unless you have a special election period, like, for example, leaving group insurance. But for most, you would make that yearly change if needed. If something changes with your prescription drug plan, then we can find a new prescription drug plan. And let me tell you how I approach those, by the way. I had a lady from Detroit call me, and I don't do a lot in Detroit, but she had been referred to me, and so she called me and she wanted to find out. So she needed a new prescription drug plan. So what I do, I check every prescription drug plan in that zip code. And not only, and Medicare.gov is a great resource, but it's not always completely accurate. And so, like, I was looking up a generic drug one time, and they had $1,000 per year for this drug, and the drug was actually only cost like $4 or something. Anyway, so there's a few things like that, but it's a great starter. And then I verify with each insurance company to make sure that this is accurate. And I had this lady, and it was a great conversation. It was so nice. And so I did my research and I presented the information to her. And there was one plan that was clearly better. I mean, it was like half the price of anything else when you take into account the premium and copays. And so I just presented it like that. And I said, this would be the next plan, and this is how much it would cost, that kind of stuff. She's like, wow, well, that first plan sure seems great. And then I said, because I don't do everything in Detroit, I don't have every company. I'm like, well, that sounds great. I think it is probably the best plan for you. Unfortunately, I do not sell that plan. I said, but I've got the phone number, I've got the contact information, and this is what you do when you call. This is how you do it, because I think in the short run, I think you can get a sale, but I think in the long run, you develop relationships, and I'd much rather that. At any rate, never too early to start planning. Again, nearly 50 different companies. There's 20 different drug plans in Kalamazoo. There's many decisions to make. What about these dental networks? What about what goes with the pharmacy that I want to use? Give yourself time to process that information and make your choices. And it's never too early to reach out, even if you're just thinking about it to see. And so that at least you have concrete numbers to put behind it. Like that 0 to 120 for prescription drug plan. Oh, my stars. That's a huge range. Like if I told my wife, like, yeah, I got lunch today, it was between 0 and $120. So, at any rate. All right. And then quickly, I'll just scroll through these in honor of Lowell very quickly. Advantage plans have expansive networks. As much as 92 to 94% of primary care doctors, many of them in our area have Borges and Bronson Solidarity Network, and even when you travel to other states. Preventive procedures, 0. Many plans have 0 copay for your primary care, for virtual care, and then different copays based on the procedure. Most of the time, I liken this to a group plan, but you guys have a pretty sweet group plan in terms of coverage and your actual network as well. And then they have a lot of ancillary benefits, and these seem to attract people. And to tell you the truth, in our area and what we deal with, probably about 1/3 of people go with supplements, about 2/3 go with Advantage plans. And when I present it, all I do is present information. That does not mean Advantage plans are twice as good. It just means they happen to resonate with more people. But that's all that is. I don't know. But then again, Mercedes don't sell as much as Fords, but some of you may want a Mercedes more than a Ford. I don't know. Once again, the same things there. A lot of different Advantage plans, and now here's me. I do the homework for you. I meet with the major carriers every year, and we go over these. How is it different? What's happening with the pricing? What are you doing with the dental plans? Have you changed with your vision? What about these networks? All that kind of stuff. Study the plans, study the changes. How are the rates increasing? And then I try my best to guide people through the process. And I found that I have enjoyed that very much over the years. And my services cost $0. And remember, you get what you pay for. So that was, that was kind of a joke. I hope So you can give me a call, you can give me an email. I will say this because this is a change from previous years. Starting in September, Medicare has put did I hit something on here? Am I still okay? Medicare has put a 48-hour window between the time that you contact me and when I can talk to you, because I'm an insurance agent, and it's called a scope of appointment. Scope of appointment says, I give Paul Miner permission to talk to me about Medicare. When you sign that, and I can actually do it via email or mail a copy or whatever, then 48 hours, and then I can talk. And they last for a year, but it's just interesting. It's their way of protecting you. Like, for example, I can't call you and say, hey, let me tell you about Medicare. I can't walk up to you in a store and say, hey, let me tell you about Medicare. because you have to give permission. There's only a couple exceptions to that. Like if you walk in, then that's different. If you just call me out of the blue, then that's different. But if we have any scheduled time together, we need that ahead of time. And so sometimes inconvenient, but if it's there for your protection, I get that. All right, that's it for me.
Thanks, Paul. So we're at the point, if you've got some questions for Paul or Miranda or myself, this would be the time to ask. Yep.
You said that you had generally 13 local plans that you find for your you consult with that are pretty good value and meet your criteria for that they merit consideration. How do we know about those? Do we just call you directly, or do you have a list of those, or?
Yeah, so the question was, 13 local plans that I definitely support or go through. And I might have misspoke there, but I have 13 companies that I deal with. And the plans I have, not even including supplements, which are like almost 80 plans I deal with. So yes, the easiest thing, because so like a lot of it depends on you can give straight quotes, but a lot of it depends on other things that you want. Like a supplement, there's a little range to give, but if you don't want dental insurance with it, I'll go a different route than if you do. And so that's why I like a personalized quote. Without, and by the way, no pressure whatsoever.
And where is your office?
My office is located at 6660 South Westnedge. It's yeah, right. It's on the card and on the paper. It's in between Crossroads Mall and the Olive Garden on Westnedge.
Okay. Yeah.
I think somebody had mentioned that the AEP is going into contract negotiation, that section on health insurance is being open. So if that,
I believe it can be open. The question was on AEUP negotiations coming year, and both compensation and healthcare are eligible to be reopened. I don't know if they've actually elected that. I don't think it has happened yet.
concern, I think that, how long will the retirees will have be covered at the rates we are now?
Right.
And if that changes, that means then that we have to drop that, or is it recommended to drop it proactively? Because I think sometimes there's a sense.
So in the question is, where do we make that decision point on as retirees? Now, it's pretty clear on spouses. If they're on the plan, they should be looking at other options. For the retirees themselves, right now it's $980 difference. And that is, somewhere around 12 or 15% premium, something like that. It's very possible down the road that subsidy could be substantially reduced. Eventually, as many of you know, future retirees won't have retiree health care at all. People that come in, faculty that come in the door now are not getting retiree health care. And it could go away for those that are in the system now. So, and that's really why we do this every year, because we take a look at the numbers and what the premiums are. And we want to see. Right now, I'm saying if you're in, I would not recommend you make a change as a retiree, because the difference is really pretty small. But that could change. And if it does, it wouldn't take, if the premium, say, doubled or tripled, I would leave it personally.
Can I add one thing on there? I'm so sorry. So I'm always cautious too. I had a couple meet with me from Western Michigan again, and the wife for sure was going on, and the husband was like, "Paul, I think I'm going to go on there too," and he was pretty sure. And I said, "Well, if you're pretty sure, why don't you just wait and see how it works for your wife, and then next year, if you want to switch, you can switch too." By the way, just so you know, I mean, change the older we get, change is hard anyway. And even if it's good change, it can be worrisome. So take as much worry out of that as you can.
Okay, yep.
So I understand that if you're a retiree and your spouse goes off, they can come back on. As a retiree, can you go off and on as often as you want?
You know, I've never had that question answered. I've actually have it in writing, the first question, and that is, if a spouse goes off the plan, Western's plan, they can come back on the, you know, any following open enrollment period for Western open enrollment period in the future, as long as the retiree is still in the plan. I don't know if a retiree can go off the plan and then come back on the plan. That question has never been put to HR, and I have not gotten an answer on that. Yes.
Oh.
You tell people what now?
Until they can return to Western Insurance.
As a retiree. Okay.
The question.
All right.
Yeah.
And the question is, can a retiree leave the WMU healthcare plan and then come back on a later date? And you're confirming that that is the case. So that's a question. That's true then for the retiree or the spouse.
Wow.
But I believe with the spouse, they're contingent upon whether or not the retiree to whom they're attached is still on the plan. Is that correct? Okay. I'm pretty sure that's the email I got some time ago on that topic. Yes.
Now, my first question is, can we equate Western's plan retirees as equal to the supplement?
Yes, you sure can. It operates almost identical to a Medigap Plan G that we talked about, with the exception that a Medigap Plan G, basically, if it's a Medicare covered procedure or whatever, then it's covered under Medigap. Western's plan actually has a few other things, not a lot of other things, but like medical massage and annual physicals are covered under Western's plan, and they're not covered under a Medigap plan or anything like that. So, but there's not a lot of things that aren't covered.
Back to this year's question about the AAUP and Western sign a contract that does not include retiree health care. Will we be going through this medical underwriting process?
Okay, the question is, if the university and the AAUP signed a contract that eliminated essentially retiree healthcare, will the person have to go through underwriting? And I'm going to leave that to one of these two, because I believe the answer to that is, if you've lost your insurance through no fault of your own, through some kind of catastrophic event like elimination of a benefit, I believe that you're eligible still, right?
Yeah. So, yeah, that's a great question. And there, yes, all these little caveats. So there is a case of guaranteed issue when you lose your group insurance because they are no longer offering it, then that is a guaranteed issue time. However, guaranteed issue means they have to offer you something, but they don't have to offer you everything on the table. Most companies do not offer G as a guaranteed issue, although we do have some companies that do. Isn't that weird? It's crazy, right? But the short answer, I should have just stuck with the short answer, is that yes, you do have a guaranteed issue period if they stop offering it to you. Not if you just leave per se.
Can I ask
Okay,
a
one of the
question
questions
over
that
the
came in
video?
on the Zoom was asking about sharing the second slide of the second speaker, which would be me. And I will tell you that those slides are with more detailed notes. They're up on the WARF website, warfwmu.org. And it's basically, if you go to retiree information, you'll be able to see those slides. They were just put up, so those are available.
Thank you.
Start with the HTTP, just.
You don't need to.
Okay, all right.
Yes.
So, questions, and I do appreciate that putting both Kathy's coverage and slides.
G right now is cheaper than Western. And I'm just wondering if it's advisable to next moment to switch, knowing that I think there's faith in G staying more stable than there is.
I'm not sure I get the question exactly. Are you saying that that spouses should switch or retirees should switch?
Because there already is $1,000 saving right now.
There is. There's $1,000 savings. Okay, so the question is, should retirees switch out to a Medigap plan or some other option, considering the fact that AAUP and the Western may decide to eliminate the healthcare? My advice would be not to do that at this time. Because even though there is some savings in premium and out of pocket and that kind of stuff between the two, there are also a few additional coverages. If you're a person who has low back issues and you have therapeutic massages, something you need to have done, there's something that you get some coverage through Western that you don't get, and same thing with chiropractic. So yes.
But again, if you switch now, you don't have this question of will it be a guaranteed issue or not.
Yeah, the question is, if you switch now, you don't have to worry about whether you'd have a guaranteed acceptability in the program. Is that a fair statement, Paul?
I'm trying to follow. You're saying if you switched now, you would have guaranteed issue?
You wouldn't, I mean,
Oh, yeah,
you
right.
wouldn't have to worry about that. That wouldn't apply at all. You'd just be switching.
Right. Oh, I see what you're saying. Yes. So if you just switch right now, then yes, you most likely have to go through the medical underwriting process. Yes.
Because Western's still up today.
Mm-hmm. But even if you're thinking about it, you're like, Paul, I'm thinking about it, then come down to my office. We'll go through the whole thing. And maybe we'll put it off for 2 months. And in just a couple days, you'll know. And if you don't pass, then you don't make the switch. Makes it super easy. You might put in a little extra work, but it's not like, oh, now I switched and whoa, now I have a problem. No. We do all that before it actually happens. So does that make sense?
We should say something about that.
Oh, hi.
And we don't know that the healthcare article is actually going to be negotiated, or if they are, I mean, how that's going to be resolved. So I mean, we're not currently in a position to say, oh, it looks like healthcare is going to go up under the WMU Blue Cross Blue Shield plan. It's really way too early. They don't really expect to really get true negotiations until pretty close to the summer. That's where they traditionally negotiate. But these are both things that the contract allows these to be open. So they're openable. And so now the two sides, the AUP and the administration, are saying, okay, well, what do you guys want? What do you want? And so they haven't really even started talking yet. The AUP has a team, and they have just started to meet amongst themselves, and then they're trying to get some feedback from faculty. You hope they would get some feedback from retirees, but they probably won't. So we just don't know about that. But I think from what Paul has said, it's never a bad time to get your information. So now you have some information from this about spouses and about the faculty retirees too. So yeah, if you got questions, try and get some answers to that, to your questions in the next weeks, months, and so on.
Yeah, I've got something to add to that too. Just as a frame of reference here, the last negotiation, the insurance was on the table, And currently we used to be back in the day, we used to be 100% covered in network. And then some years ago, it was reduced to 90-10, 90% coverage in network and 10% co-insurance. That 90-10 split was on the table this last negotiation. And to AAUP's and the administration's credit, they maintained that 90-10. And the out-of-pocket maxes did not go up huge because they go in partnership. If you've got 90-10, but you've got an out-of-pocket max of 5,000, well, you can run into some big bills in a hurry. So during a negotiation on healthcare this past time, it remained pretty stable. So just because it's like Bill said, it's openable, but it doesn't necessarily, it's going to be open. And even if it is, who knows where it's going to end up. So, yeah.
I'm just wondering is another concern that if one is going to switch for no matter what reason, but out of switch to something else, isn't one more likely to be accepted now as opposed to when one ages? So I'm guessing if I'm enrolled in health right now, 10 years from now, whatever, it seems like being accepted now doesn't guarantee acceptance in the future. And I'm just wondering if that's something that I don't know how high is that bar for being accepted or being accepted at a higher
So the question is, if you're going to consider switching, age is when you do it is a variable that may affect whether or not you're able to do it, either medical rating wise or premium wise or whatever.
Yeah, that's a great question. And thanks, because I kind of flubbed the last one for what he was looking for. And I think this is the idea. Right. Yes. So if you're still in great shape, that makes going through medical underwriting super easy. And if you wait until there's a significant issue, then you may very well not be able to go through medical underwriting. So if there is, right, and like if they eliminate healthcare, then yes, that triggers a election period. But if they double your costs, that does not trigger a guaranteed issue election period. So yeah, if it's close and it works for you, I had someone on the chat say, hey, which one is the best? A plan G or like, there's no right answer to that because it depends on you. But if you think it's something for you, now when it's super easy to get through your medical underwriting because you're in great shape, then now is a great time. Yep.
I just had a question about a spouse. I switched several years ago out of Westerns. I was on Al's policy. And I've been very happy with the policy. The switch, I went with Blue Cross. But I'm wondering, and I would not want an Advantage plan, but is there a difference between, like you mentioned, Kathy was United?
Yeah, United Healthcare with
Part G, and I'm Part G, and others friends have had priority. Is there varying differences between the other companies? Like, I'm wondering, should I bother to even look if I am happy? But it is expensive what we have.
Yeah. So the question is, if you're in a plan, supplemental plan now, does it pay to shop around? Or I would defer to Paul on that one.
If I was a barber, you always need a haircut. So yes, I mean, so no, but this is kind of a funny thing because I've gotten to this point as I'm talking to people about supplements. I kind of see supplements like the cable company. When you stay with them, you're going to pay this rate, but a new person would pay this lower rate. And that's not true for everybody, but for most people, there have been numerous people that the reason they go through medical underwriting with me to switch is because maybe they're paying $300 a month. They get the exact same plan with a different company for $180 a month. It's amazing. Now we check other things too and make sure if we also did a dental switch that it was still going to be good, because a lot of times it's associated with your supplement. But it is always worth shopping around. And here's the other thing. Like one person was like, I want to shop around. And I'm like, yeah, well, I found one that was $2 a month cheaper. It's not worth the hassle. But then and then you can rest in peace, not thinking, am I leaving all this money on the table and I don't have to?
But your G from his wife's G to your G, they're covering the thing.
Right.
Yes,
So
Yeah.
you don't, it's really just the cost. that
Right.
You're really trying to figure out, maybe he's paying a little bit more. Because there have been people that I've seen where each year for supplement plans, they look at, to switch different plans, and that's risky. But people can do it if you're.
Just to give you an example, I didn't break it down in detail like this when I presented, but Kathy's Plan G premium is $174 a month. And that's with United Healthcare AARP sponsored program. Her RX is through Aetna for $5 a month. And her dental is Blue Shield, $47 a month. And she has shopped the dental and the RX. I mean, there have been times when she has not switched, but there have been times when, it pays to go back out there and look and compare.
Right.
So, but she's been happy with, she has not had any surprises on the premium on United Healthcare, but like Paul says, they're all different in their pricing mechanisms. So it pays to look.
Yes, but overall, I have found, and initially, when I made the change, I wasn't clear, do people change at every open enrollment? And I called and asked them, they said, no, most of the time.
Yeah.
You stay.
Yeah.
And I was kind of relieved after getting on. The hard part was leaving Western. And
Right.
Al.
That's exactly right.
You went through the same.
The anxiety is leaving the Western plan to start with. I'm not aware of anybody that I've talked to that has actually switched the base plan. Now, maybe some people have had some escalating premiums, but I know a number of people that have switched the dental and the RX, that kind of stuff, because those are all a la carte, and you can add those,
Right, okay,
So-
that's initially what I thought.
Yeah.
Is this answer, and it doesn't hurt to jump around either, but,
Right.
I think, at least in this case, it's similar.
Yep. Yes.
Can your supplemental insurer drop you?
Repeat.
So not as long as you're paying your premiums. I'm sorry. The question was, can your supplemental insurer drop you? And the answer is not as long as you're paying your premiums. They may go insolvent and if they go bankrupt and out of business, but that does generate a special election period for you to switch.
We're okay with this one. Questions?
Yeah. Okay. Oh, here there's one on here that just came in. Repeat the email address, phone number for Paul. We can do that, but it is on the WARF website. So WARF, WARF, WMU.org, and just look under retiree information, and there'll be a healthcare bullet, and just click on that. And what you'll find there is the two charts that I showed you with more detail. And my presentation notes, and the last page of that is the contact information from Miranda, myself, and Paul. So I can repeat it here. His phone number is 269-323-7888. His email is paul@endresins.com. And he's located at 6660 South Westnedge in Portage. So, yep.
Paul, you used the term excess charges when you were talking about Plan N. What are excess charges?
Question. The question is, what are excess charges like we talked about in Plan N? So if a provider says, yes, I take Medicare, but no, I don't ascribe to their rates, then for any Part B charges, they can charge you a 15% more than what the bill would normally be. And on Part N, you would be responsible.
That survey you spoke about, where could we get that? I don't think I've ever filled that out. Where is it? Do you email it to us?
Yes, you're a WARF member? Yes. Yeah, just after you give me your name and check, well, we have sent it out in the last week or 10 days to WARF members with the email address that that you have, but I can check and make sure that one went out to you. We just did talk to someone earlier today who they the auto respell that person's name and they shouldn't have, so it might be something like that. But the survey is out there. It's to WARF members. It also should be on the website, the WARF.org website, so it should be there. But if you'll check with me afterwards, I will make a check and then let you know. Yeah. Well, thank you all. Oh, yeah.
I got kind of a surprise today. I just went through this process with Paul and put my wife on a supplemental plan, but I got a notice from Social Security this week that says that I got an IRMA charge, a premium charge on plan on the D, plan D, which I never had before. That was on plan. Always got it on plan B, but plan D, they dinged us for.
Or income related.
Yeah,
yes.
yeah.
So interesting that you didn't have that before.
Never had it before.
Because it's just based on
Well,
yeah, I'm sorry.
Didn't have a plan B with Western.
So the question was getting an IRMA charge on Plan B or Plan D or Part D, I should say. It's all income driven, and Western does have a prescription drug plan. So I'm not sure why you wouldn't have had it before. And it only triggered now. I'm not sure. It is income based. So if you're a married couple filing jointly, if you make more than $206,000 from 2 years ago on your taxes, then they will charge you a little bit extra. So no idea. It's a government program. Maybe you would know. Yeah. Right. Yeah. So it should be the same because you still have Part A and Part B, and you still have drug coverage. I don't know why it's different. If you just made less, we wouldn't have this problem.
All right. Yeah. So one last question. Go ahead.
In this case, with the increases in Social Security, that something like that, as it goes up a little bit.
Yeah, maybe you get a little more Social Security. That might be part of the because your Social Security income has gone up.
Maybe it's just enough to bump.
Yeah, it could be. I don't. We don't know what the answer to that is, but.
Well, I was just surprised that, I'm not protesting or anything.
Yeah.
But I never got an IRMA charge on drug claims before. And they made it clear, hey, you're getting it on the drug plan.
Well, thank you all for coming out. I just want to mention too that a couple of our steering committee members are here, Christine Browning and Bob Balik and Lowell, myself, Peter Karutsky, and Emily Hoffman are also there. I think they probably are on Zoom or otherwise listening to this, but we're trying to provide you information, and we hope that you'll use this information to help you and your family get the insurance that fits your needs. Again, if you are a WARF member, please do try and fill out the survey that should be on the WARF website. That's our way of getting information from you about what your priorities are, and therefore obviously what we should do. We are looking for some new WARF members. So if you're interested in that, we only meet steering committee quarterly, 4 times a year, so it's not a major obligation. Thank you so much, for attending and, drive safely.